Hi, I'm Dr. Patsy Kelso with the Vermont Department of Health, and we've put together this little webinar to introduce you to NHSN. A lot of you have heard of NHSN. It's a little bit scary. I understand that, but actually once you realize what we need from you and how NHSN works, I think you'll realize it's not so scary after all. When your healthcare facility sends a specimen to the lab and they identify an MDRO, that patient needs to be reported to CDC. So we get a positive lab result, now what? What do we do with that? So the first thing you need to do is request a digital certificate. And a digital certificate is just a way for CDC to authenticate that you are who you say you are. That's really all it is. And once you have one, you can have secure access to CDC's NHSN system, the National Healthcare Safety Network, for reporting the MDRO data. CDC gives digital certificates to individuals, not facilities. So you need to have at least 2 people in each healthcare facility who have a digital certificate and can therefore access NHSN. Again, the certificate belongs to a person, not the facility. So if a person leaves or retires or is out sick, no one else at that facility can use their certificate, just them. That's exactly what a certificate does. It says, I'm Patsy Kelso and I'm allowed to report into NHSN, but no one else can use my certificate because they don't have my login information. So you need to have at least 2 people at your facility who have a digital certificate, and then if somebody leaves, you'll still have 1 person who can get into NHSN. So once you request a digital certificate, CDC will send you an email when your digital certificate is ready, and then you need to install it on the computer that you're going to use to access NHSN. If you don't install it within 30 days of getting that email from CDC, the certificate will expire and you'll have to start over and request a brand new certificate. So watch for the email once you've applied. The email will say your certificate is ready to be downloaded, and then within 30 days you need to make sure that you get it installed on your computer. You might need help from an IT person to do that. Not that it's really difficult to do, but in a lot of facilities, even the health department, we don't have permissions to do that on our own, so we can't really do it without IT help. Once you have your digital certificate installed, then separately you have to apply for access to NHSN. So the certificate is just a way for CDC to verify that you are who you say you are, and then once you have that, you can access NHSN, but you have to apply for that too. And it can take a while to hear back. It can take several days or a few weeks, so don't be discouraged. And if you're frustrated or need help, don't hesitate to call us at the health department. We have lots of experience with CDC digital certificates for lots of other things. So once you're in NHSN, you need to set up a reporting plan. That tells CDC what data to expect from your facility every month. And if you don't do that, CDC won't be able to receive your data because they won't know what they're expecting. So they won't be set up on their end to receive it. So you need to set up your reporting plan, and then you need to also identify for NHSN who the users will be from your facility. And all of those users, remember, need their own digital certificate. And now you're ready to submit data. So when you get that lab report of a C. diff or a VRE or an MRSA, you'll be ready to go into NHSN and report it. In addition to the actual patient data, there are a couple things you need to report in NHSN, and we call them the denominator data. That's the total patient days and the total number of admissions. So every facility has to enter those 2 total numbers every month. Now, how do we actually report the data into NHSN when we get one of those lab results? So there are 2 options. One is for each long-term care facility to enter their own data manually, and we'll talk in detail about that. The other option, option 2, is for the hospital infection preventionist to enter the long-term care data for them. And if this route is chosen, the hospital is also going to enter it manually for now. In several months, once CDC gets the NHSN system prepared, they will be able to accept long-term care data electronically. But we're not there yet, and you don't need to worry about that now. I think it's quite a ways away. So just to review, there are 2 options. The long-term care can enter their own data manually, just typing in the information. or the hospital can do that for the long-term care facility. And within each cluster, the long-term care facility and the hospital just need to chat and figure out what's going to work best for them. So to go into a little bit more detail about each of those two options. First, the long-term care data entry option. The hospital infection preventionists, when they find a lab report from your facility of an MDRO that needs to be reported, they'll let you know at the long-term care facility. And there are a few data elements that the long-term care facility will need to provide because they're not captured anywhere on the lab report. So the hospital IP doesn't have this information. And those things are resident type, either short stay or long stay, date of admission or transfer, social security number of the resident, and then the primary resident service type. So this could be long-term general nursing, long-term dementia, long-term psych, or skilled nursing. So it's pretty much those four elements. The hospital IP will identify a lab report that you need to get into NHSN. You'll need to gather those four items that I just mentioned for that patient, and then you'll log into NHSN, type in the information, and then once every month enter that denominator data. And that's it. The other option is for the hospital IP to enter the data for you. So again, once the hospital infection preventionist sees a lab report that needs to be reported, they'll contact you, and you'll need to get them that extra information that's not on the lab form, you know, the resident type, etc. So you'll need to give that to the hospital in some secure fashion. It could be over the phone, if they're willing to just talk to you and hear it over the phone and write it down. It could be some kind of secure fax, or even it could be some fancy electronic file transfer system that's secure. It doesn't really matter, as long as you're sharing the information in a way that keeps it confidential. So once the hospital IP has those few extra data elements that she needs from you, she or he will enter that report into NHSN for you. If you want to choose this option, then the hospital IP needs to be included as a user in your long-term care facility's NHSN account. And that's something that facilities need to consider, whether they want to allow the hospital IP access to the NHSN system data for their facility. It's certainly something you can consider. We don't have a problem with that. So which option is best for your facility? It's going to have to be a discussion between the hospital IP and the people at your long-term care facility who are going to be responsible for getting that extra data and either giving it to the hospital IP or entering it themselves. So chat between yourselves and figure out what works best. Some of the things you can think about are, is there a lot of data from the long-term care facility, or do we really only have 1 or 2 cases every few months? That might make a difference in whether you decide to enter it on your own or have the hospital person do it if they're willing. Think about who in your facility is going to help you gather that denominator data, the admissions data, because maybe that person could be the one to enter data into NHSN too. It doesn't have to be a nurse who does the data entry. And of course, is the acute facilities infection preventionist willing and available to do the entry for you? So talk it over, figure out which way you're going to go with, and then submit that NHSN reporting form back to the health department. We need one of these forms for each facility. It's not good enough to just call and tell us, oh, we've decided to enter the data on our own. This form asks for some information that we need to help you move forward. So not only which option you're choosing, but who is responsible for data at each facility, and who's the backup person, so that if there are problems, we know who to get in touch with. So hopefully that makes you realize that NHSN isn't a huge challenge. It's new and it can definitely be a challenging system, but we're here to help. So talk it over among your facilities, let us know what you decide, and we'll go from there. Thanks.